we have Dr. Pramod here from Apollo Banarata Road, Bangalore. Hello, sir. Nice to welcome to CareCon Vijaypura, Nammauru. So 2026. So it was a wonderful talk that you gave right away about
Thank you.
the
Thank you.
Mets.
Yes.
So your keynotes, we have two questions for you today. So the one is, how would you want to create awareness in orthopedic spine surgery in this generation, in this day of AI, digital world, and how would you want to go ahead with it?
Correct. So I keep telling this in my talk. There are three T's which have changed the practice of spine in the last decade or so. So one is the training. You know that all the spine surgeons who are being trained now are trained under formal spine fellowships from the ASSI or from the FNB,
Yes.
and all the long duration trainings and the international trainings does matter and does change the way the spine surgery practice is going. Another key is technique. Again, there are a lot of changes of technique where we used to do open techniques. We have moved to MIS techniques, endoscopy techniques. A lot of techniques. It's not that one technique is superior to the other. It's only that whichever technique works well in your hands and whichever technique you are trained under and you are good at, you have to follow and give good outcomes to the. So outcomes is the final thing is the outcome. And the third T is technology, like how you said. You have to adopt to the new technology. We have to adopt to the AI. So even in my presentation today in Spine Meds, a lot of my infographics, everything was done by Gemini. So it's like I used Gemini to do deep research on the topic, and then it gave me a lot of papers to study for, and it gave me those things. So these three T's and the robotics, navigation, and all that. So all these three T's are going to change the way orthopedic spine practice is going to go forward.
Wonderful, sir. So it's the three T's that we have to adhere to. And my second question would be like, what would be your two pro tips for the young budding orthopedic spine surgeons, like who are all based in tier two cities and who are all struggling? I wouldn't say that way, but what is your take on that, sir?
Yeah.
Like, what do you suggest?
So I have worked in both Tier 1 and Tier 2 cities because I worked in Bangalore for a while for 3 to 4 years, then moved to Calicut in Kerala for 5.5 years, then back to Bangalore now. So even myself, I have sort of evolved over the last 10 or 12 years of my spine practice. So somebody who is in Tier 2 cities, actually I feel it is much better in Tier 2 cities with the competition and with the patients. The digital aspect of it, like probably you have to sit in one place and then develop your practice. You have to develop contacts with your orthopedic surgeons and the colleagues. You have to develop the rapport with the patients, and each patient is going to refer you multiple patients. So it is the word of mouth, and it is the rapport which you develop with your orthopedic colleagues and your seniors, which is going to matter over the long term.
Thank you so much, sir. That was a
Thanks.
wonderful advice.
Thank you.
And once
Nice
again,
to talk.
welcome to CareCon Vijaypura, Namma Vijaypura 2026. Thank you, sir.